Hello, everybody. It's nice to see everyone here. My name's Chris Morrison. I'm an associate professor at the Yale School of Public Health and also the scientific director for our firearm injury prevention group. I'm stepping in for my colleague Kerry Racian, who was not able to join us today. This is a seminar, part of a monthly seminar series that's co-sponsored by UConn Arms and Yale's firearm injury prevention team. We're very proud to host this year's monthly seminar series. On Target meets about once every month, and it gives an opportunity for dissemination and discussion about emerging firearm injury prevention topics. The seminar is open to all researchers, policymakers, practitioners, and anyone who wants to know more about research in this area. So if you'd like to present, please email us and we'll drop that information in the chat for those of you who are watching, who are with us live. And otherwise, you can reach out to our team here. We welcome presentations from all scientific disciplines focused on firearm injury prevention. Our next seminar will be on March 11th and will feature Michael Ulrich, who's an Associate Professor of Health, Law and Policy and Management at the Boston University School of Public Health. And we'll put an RSVP to that session in the chat also. Now, today I'm quite excited to welcome Dr. Steve Hargarten. Dr. Hargarten is a Professor of Emergency Medicine and the founding director of the Comprehensive Injury Center, and is a senior science and policy advisor at the Medical College of Wisconsin. Now, I know Steve from his role as co-founder and member of the Secretariat for the Global Coalition for WHO Action on Firearm Violence, which is an international consortium that aims to shape WHO action to prevent firearm violence globally. Dr. Hargarten's research interests reflect an intersection of injury and violence prevention and health policy to address the burden of this complex biopsychosocial disease. His work in linking data systems for understanding violent deaths helped to inform the development of CDC's National Violent Death Reporting System. He leads ballistics investigations with bullets linked to civilian deaths and injuries. Today, Dr. Hargarten will present The Pathogen of Gun Violence, a public health introduction to wound ballistics. The format of this presentation is that Dr. Hargarten will present for roughly 30 to 35 minutes, and then we'll open up for question and answer. So feel free to drop your questions in the chat. After Dr. Hargarten's presentation, I'll moderate a question and answer session, which you can do either by adding your questions into the chat or raising your hand and unmuting and asking your question live. So please remember to keep your microphones muted for the presentation portion of this seminar. And please help me in welcoming Dr. Steve Hargarten.
Thanks so much, Chris, for that introduction. I really am pleased and honored to be able to present to this group. And it's really great that this recurring monthly meeting to help us better understand firearm violence continues with such great opportunities for that discussion to occur. And I really appreciate the opportunity to present our way to look at firearm violence and perhaps identify some prevention strategies. I have no current disclosures or conflicts of interest to present. We did have a National Endowment for the Humanities grant on gun safety patents, which was terminated. I want to present presentation elements. My presentation elements include some background definitions. I want to dispel myths and then present a ballistic studies, a primer for the audience, and a presentation of categorizing bullets by what they do and summarize this research with its implications for care and policy. like the audience to keep this particular image in mind as I go into the science of wound ballistics. So many people are injured, as we all know, and killed by bullets every year in the United States. Most of the research and policy discussions, besides on human behavior, is also focused on firearms. The categories of firearms are generally discussed as handguns, shotguns, and rifles, and relatively less attention has been to characterize ammunition, bullets, beyond their size. And I will report our wound ballistic studies that quantify what bullets do to human tissue, a new way to categorize bullets. So the way I frame it is that injury is a disease. It has a physical agent, kinetic energy, and a pathogenesis, the acute exposure to this energy with cells and tissues unable to absorb. Think of a car crash and our inability to absorb that kinetic energy transfer to our chest or abdomen. There's morphological changes of cells tissue. There's tearing, edema. That's where we come in as emergency physicians, as surgeons, where there's a clinical significance. There's fractures, hemorrhage, subdural hematomas, shock, and death. It has all of the elements of a disease. We know that we have vectors of disease. And in this case, this little guy accounts for about 750,000 deaths each year in the world. Malaria is one of the major diseases. And so we want to frame, if we want to look at public health approaches to addressing gun violence, we can learn a lot for how we have attacked infectious diseases such as malaria, which has a vector. So on the left-hand side, we see malaria, which has an agent, is a biological agent in this case, it's a parasite. It has a vector which carries that parasite to the human. There's an environment where that mosquito grows, and there's hosts, children such as children and older adults. So if you go to the right-hand side, the gunshot wound, there's an agent, a physical agent, the kinetic energy of the bullet, which is carried by a firearm, a handgun, or a rifle. And there's an environment in which these events are occurring with hosts, homeowners, criminals, juveniles, and as we know now in the United States, as of these past few years, that bullets are the leading cause of death of 15-year-olds. So the way we frame it is that bullet on the left-hand side, the left side of the chest, is an infiltrate like a staphylococcus for pneumonia. We want to understand the dynamics of what that bullet does, in this case, elastic tissue, that perhaps we can leave it alone, we don't need to do much, versus something more aggressive that is required for caring of the patient. These are the viruses, if you will, that attack our patients. From the left-hand side, smaller bullets, smaller caliber, to the right-hand side, where there's a larger mass with also an attending increase in velocity. And think about your basic high school physics. Kinetic energy equals 1/2 mass, the mass of the bullet, times the velocity squared. And that's where the kinetic energy deposit in humans really changes, when that velocity changes. And we're going to get into that in a moment. And this is an example of the vectors that carry these bullets. From the lower left-hand side, a Raven MP25 caliber bullet, that handgun that we identified in Milwaukee County years ago as one of the most common identified vectors, if you will, linked to homicides in the city. In the middle is a Glock, which is a favored firearm that is carried by law enforcement. So the ballistics that I want to talk about is that science of the motion of projectiles in flight. And that came from the Greeks many, many centuries ago, where you hurl a rock, you hurl an object towards something for some intentional harm or some intentional outcome. So if we want to look at the simple ways in which we're framing ballistics for bullets, is we go from the left. The bullet, when it leaves the cartridge and it goes through the barrel, that's an internal ballistics. That dynamic force of the bullet leaving the barrel of the gun. And once it leaves the barrel of the gun, it becomes another element of ballistics, the external ballistics, the flight of the bullet from to its intended target. Its dynamics, its ability to stay on target. It's rotating so that it enhances the ability to reach the intended destination. And then finally, there's terminal ballistics, which is when it strikes an object, a car, a wall, or in the case that we're interested in, a human being. And within the subset of terminal ballistics is wound ballistics. That is the study of the bullet in a human body. And that's where we want to focus today's discussion. And then below wound ballistics is ballistics trauma, which the surgeons take care of in the operating room when the bullet has damaged organs that need repair. So we're talking about terminal ballistics, but a subset of that, wound ballistics. Cartridge ammunition that is found in ammunition now, the cartridge ammunition is a cartridge, generally consists of four parts: a bullet, the propellant that pushes that bullet out through the barrel, the casing that holds the bullet as well as the propellant, and a primer that once you ignite it with a hammer against the firing pin, it releases the ignition of the propellant, which then, when it starts to burn, the gases expand, pushing the bullet out. So the bullet is transported, and it's a transfer of kinetic energy to its target. And the gunpowder is the propellant. There's a lot of history to this. We don't have time to get into it. It's a really interesting development of this phenomenon. And it was striking for me when I saw the shape of a cartridge of it being very similar to a rabies virus. And these are just an example. Here's a musket rifle projectile, a spherical ball, and here's the conical shape of a AR style 15 rifle bullet, a 5.56 NATO. Look at the difference in shapes that have occurred over the centuries. So gunshot wounds are named as evidence from the manner in which they are reproduced. And I love this quote from John Hunter, a prescient surgeon who really started to think about this in a science-driven way. If the velocity of the ball is small, then the mischief, which I really think is interesting, is less in all of them. There is not so great a chance of their being compounded with fractures of the bones, but if the velocity is sufficient to break the bone it hits, the bone will be much more splintered than if the velocity had been very considerable. For where the velocity is very great, the ball, as it were, takes a piece out. However, all this will vary according to the hardness of the bone. So interesting that he is describing this in 1794 with his keen observations without any attending technology that we have at our disposal today. A bullet wound described circa 1890s by Sir William Cormack. The bullet wound is an extreme form of contused wound combined with the dangerous depths of a punctured wound. And for those of you who may have watched the Netflix series on President Garfield and his unfortunate death, recognize the fact that if he had been treated with current standards, he would have been alive and continued on with his presidency. And it really was a tragic death because the understanding of what a gunshot wound was poorly understood back then. Currently, this is a quote from Eugene Stoner, who was one of the really pioneers of developing the AR style 15 rifle platform. There is an advantage that a smaller light bullet has over a heavy one when it comes to wound ballistics. What it amounts to is the fact that bullets are stabilized to fly through the air, external ballistics, and not through water or a body, which is approximately the same density as the water. And they are stable as long as they are in the air. When they hit something, terminal ballistics, they immediately go unstable. If you're talking about a 30 caliber, like a bullet used in the Army's previous M14, this might remain stable through a human body. While a little bullet, being it has a low mass, it senses an instability situation faster and reacts faster. And this is what makes a little bullet pay off so much in wound ballistics. And that's the velocity that it has when it is released from the rifle. 1/2 mass times velocity squared. This is a good example of the myth of gunshot wounds. Many of the audience might recognize this classic Western film. Doesn't happen. Excuse me. I thought I'd be able to show it without canceling the action of Jack Palance going through the bar, being pushed away by the bullet. It just doesn't happen because Newton's law would be violated. Just show you that one more time. It's the myth that was perpetrated for many, many years and includes sometimes even in films today. So if we're going to understand disease transmission, where's our microscope? How are we going to understand this phenomenon when we see disease transmission with viruses? We see them coming into cells and destroying cells, in this case, maybe with COVID or other viral diseases. So the video camera is a microscope of our biopsychosocial disease. It's a way for us to look at the bullet's behavior in gelatin, which is a facsimile of muscle tissue in this case. And so we don't have a hospital lab to go to study this. We have to go somewhere else. And in this case, the crime lab, which is a forensic unit to understand the linkage of a bullet and a firearm to a crime. We can advance our wound ballistic studies, and they have become great partners, along with engineers, biomedical engineers who studied car crashes and the energy release in that situation, be able to understand now what bullets do to help caring of a patient or perhaps informing policy. So on the left, we can see the lab setup. In the background is where the gelatin is. There's a lot of light there, so we can see the bullet going through the gelatin. Here's our research scientist setting up the computer, the high-speed video camera. It's an extraordinary technology that can look at and frame the travel of the bullet by having frames of 50 to 100,000 frames a second. So we can watch that bullet that's traveling 1,000 feet per second, 3,000 feet per second, and really see how that bullet behaves as it enters the gelatin. And on the right is where the firearm is rested for the release of the bullet by the leader of the crime lab. So our method, we use high-speed video camera to record the bullet's behavior. That is the wound ballistics in the 20% gelatin. We have tested multiple firearms and ammunition across a range of calibers. And we, as I said, conducted our studies at the Milwaukee Crime Lab. And we've conducted additional studies in England with the Cranfield Forensic Institute. So here's an example of what we found. And look at this as a 25 caliber, small caliber, and the bullet's going to go from right to left. And you can see that there's going to be a permanent and temporary cavity formation. So here's the permanent cavity formation, and you saw the varying degree of the temporary cavity, which is the radial dissipation of the kinetic energy to adjacent tissue. So that permanent cavity injures cells and tissue directly as it travels through an organ like a liver. And the temporary cavity has that, again, additional kinetic energy dispersion adjacent to that permanent cavity that may then create additional damage to inelastic tissue, such as liver and spleen. Here's a different caliber, a higher caliber 40, and there's a different mass, but also an increase in velocity. Again, right to left, you'll see a different permanent, but more importantly, a different temporary cavity formation. You see that is very disruptive to the tissue, to the gelatin, and a larger temporary cavity with that permanent cavity traveling through the gelatin. You can predict that there's going to be additional injuries to the intended target. And the kinetic energy deposit is different. Again, this is happening in milliseconds. So this is a 5.56 NATO. This is a bullet, a cartridge that is commonly used in the platform of AR style 15 rifles. It's also referred to as a 223, which you think about 223 caliber, that's smaller than the 25 caliber that you saw moments ago. So this is a small caliber, but it has a velocity that's significantly different than the 25 caliber bullet from a handgun. So that's the important difference, is that this is a low caliber projectile, and yet it has a significantly different effect to the human tissue. Sorry, try to figure out how I can stop it in a way that helps us see this effect. Think about this now as a very different wound ballistics event, ballistics implying ballistics trauma to the patient. This is the intended outcome that Stoner was talking about when he was developing this firearm and the bullets they carry. But think about this in the context of school shootings. Sandy Hook. This is the bullet used in the Sandy Hook shooting. 6 and 7-year-olds, none of those children survived. No, none of those children even made it to the emergency department. The case fatality rate for 6 and 7-year-olds for this bullet is 100%. In Uvalde, same bullet, same school setting, same single shooter with the same bullet, as I said. 62% of the children died. These are little older children, 10, 11-year-olds. In Parkland, same school setting, same single shooter, same bullet. Half of the children died. So think about that as another way of understanding the dynamics of a bullet that is age related, which we have not seen and not being able to analyze this. But with this case study, unfortunately, we're seeing this unfold in these school shootings as an example of how these bullets interact differently, in this case, by age. This is a summary of some of the work that we've done, of summary of velocity and energy data from each round. But look at this energy transfer. That's the key element that we wanted to quantify from a 25 caliber of 57 joules, very low, has some wounding potential, but not as great. We go to 32 caliber, a little higher. 40 caliber that you saw with 235 joules. We also released a submachine gun Thompson 45 auto, which is a handgun cartridge as well, with an increase in joules. And then look at the step up for the 5.56 NATO of 1,300 joules. And we looked at rifles like the 30-06 with its significant increase in joules as well. But this is what we wanted to look at and be able to categorize bullets by what they do, the energy dissipation and the attending temporary cavity formation. That's significantly different, as you saw from the 3 videos. So we want to look at how we can and should categorize bullets by what they do and not necessarily by their caliber. In this case, with some of the work we've done, look at the energy transfer by bullet caliber. This is 5.56. It's a small caliber, as I mentioned, like the 25 caliber bullet. It's smaller, and yet look at the energy release compared to that 25 caliber. So identifying and categorizing bullets by caliber is misleading because we're not really attending to what they do, such as the 5.56 or the 30-06. And here's the higher calibers, 45. Look at the energy differences that we saw. So we wanted to take a look at how we can do an energy transfer classification by what the bullets do by energy. And we can see by doing that, we have a different categorization that perhaps identifies the wounding capacity of a firearm that carries a 5.56 NATO. And that, I think, is helpful for us to predict wounding for our patients, but also perhaps informing policy by how we categorize bullets and firearms by what they do to humans. So the discussion and implications, and again, we're looking forward to the Q&A. we want to develop a taxonomy of bullets based on what they do to tissue and organs, that kinetic energy release that we've quantified, rather than by what they look like, the caliber, bullet size. And a lot of times it's been done with muzzle velocity. That is the velocity of the bullet as it leaves the barrel of the firearm. And look at the muzzle velocity between two similar calibers, 25 and 223. So we are proposing a paradigm shift for classifying bullets focused on the energy transfer, in this case to gelatin. We can't do these experiments with humans, but rather the previous classifications, again, by caliber, muzzle velocity, or combination of the two. So we want to classify bullets by their transferred energy, and that table is what I showed you, resulting in a more explicit quantification of the potential for harm. And providing a hierarchy of bullet wounding potential, this can inform trauma surgeons in their clinical care. Perhaps they may choose to have a non-operative management because it's a lower caliber, lower energy injury. But also we think that it can inform firearm and ammunition policy discussions by classifying them by what they do and not by what they look like. I want to just end the presentation with a couple of other issues and ideas. This is a cliche that we've seen over 100 years now of guns don't kill people, people kill people. And that behavioral identification of people killing people, it's important. We need to understand behavioral issues of why an individual looks to harm another person. But from a science viewpoint, this is not exactly on target, if you will, for what we want to better understand for firearm violence and maybe understanding ways to prevent it. So with Senator Moynihan expressing this well over 30 years ago, guns don't kill people, bullets do. And the video camera now allows us to see what bullets do. In this case, in facsimile of tissue, and we want to learn more about what bullets do to help inform the care of patients and perhaps inform policy. So this is the phrase that I find to be much more science-driven and more immediate to the implications for patients. And this slide gives you an idea, and then Chris mentioned that I'm involved in a global coalition now to address firearm violence. You can see the age of the perpetrator from these two groups, Chicago and England and Wales. The age of the perpetrator is virtually identical in these homicides. And that distribution continues to today. And yet look at the rate of homicides in Chicago versus England and Wales. The access to a vector, the access to a pathogen in Chicago is different. And it suggests that this is a good example of the pathogen of gun violence. And in this study, they were just trying to understand social determinants of these individuals, of 20-year-olds from England and Wales and 20-year-olds from Chicago. My assumption is that they're basically similar in their social determinants, but they have different access to lethal means. So bullets matter. The pathogen of this complex biocycle disease of modern society is a real important area to investigate and understand better, and their distribution. So we're feeling that we should categorize firearms by their capacity to harm and categorize firearms by the bullets and ammunition they carry. The perpetrator of Uvalde at 18 years of age was able to procure an AR Style 15 rifle platform and secured 1,600 rounds. I've heard varying degrees of amounts of ammunition that he bought. That was one figure that I found. 1,600 rounds of 5.56 ammunition. That energy equivalent is greater than 2 Army grenades. And yet he was able to purchase this without any questions or any limitations. So new knowledge is the most valuable commodity on earth. The more truths we have to work with, the richer we become. And I wanted to end with that, and also to end with a picture of my granddaughter of day one. I would like to see that by the time she's 15, that bullets are no longer the leading cause of death in this age group in the United States, and that the world is a little bit healthier and safer for her as she blossoms into adulthood. Oh, thank you for this opportunity to present this wound ballistics primer. It's an under, and please open it up for questions. I welcome this opportunity to engage with the audience. So thank you so much.
Thank you very much, Dr. Hargarten. That was a wonderful reminder of taking a public health approach to firearm injury prevention means paying attention to vectors, agents, and people as well. So we'll take some questions in the chat or raise your hand. Does anyone have any questions to get us started with, or would you like a moment to type them into the chat? If anyone has a question, please feel free to raise your hand, and I'll call on people in turn as I see them. A question from Kenyatta.
Thank you for your presentation. It was amazing. I'm Kenyatta Hazelwood. I'm in the PhD in nursing program and also Director of Trauma Services as a nurse. So I appreciate your work in the hospital space. I noticed that you have some, many of the ballistics that you reviewed were associated with the school shootings. I wanted to know about your opinion as it pertains to community violence. And so those caliber of bullets, I know when we do our trauma M&M, our medical examiner comes on and we get these pictures and these different bullets, but I haven't really looked into, the community violence piece versus the school shooting piece. Do they have less access to certain guns? Are we looking at different ballistics for ghost guns, et cetera? So just like your thoughts on that.
Just a great summary and a great question. So thank you so much for that. So a couple of things. First of all, we did the school shootings because it's in the public health and in toxicology area, it's like a case study. And so we had control of the bullets in a controlled setting, schools and so forth. And that was an example of how we can begin to learn how, in this case, bullets affect children of differing ages. But to your point about community violence, we're seeing 9 millimeters as dominating the bullet that we're seeing in our emergency department and trauma centers in Milwaukee. And I suspect it's not much different from what you're seeing in your community. I didn't catch which city that you're in, but I'm sure it's
Washington, D.C.
so I think it's probably going to be very similar. We fired 9 millimeter ghost guns, and we found that they're releasing an energy equivalent to a 9 millimeter from a typical handgun. And so we want to understand this dynamic more and more. And we have started a study looking at the non-fatal injuries that come to our emergency department trauma center, work with the police to find out what was the bullet's caliber. So they commonly, because it's a pistol, there's a casing on the ground. They're picking up the casing for forensic information, but we want them to tell us what bullet is now injuring our patient. And we can better understand, perhaps at the higher caliber, and we think that's going to be the case, they are in the emergency department and hospital, and they end up being in the hospital longer. They have more operations. They have more blood work, blood needs, and so forth. And that I think is an opportunity for us to better understand wounding by caliber. And so we're doing this for the non-fatals. And to your point, Canetta, about the medical examiner, we think, and we're excited about this in Milwaukee, that the medical examiner is going to have a CT scan. And we want to have a CT scan documenting what that bullet did to the liver, what that bullet did to organ systems in the pelvis, whatever that case may be, and link it with the bullet that did that damage, because the police have that. Because commonly the bullet has perforated the human and there's no bullet to be found. Or if it is, we can determine that in a more quantified way to better understand what's going on with our patients. So your question and summary about community violence is spot on, because we want to learn more. And what we're seeing, again, as I said, 9 millimeters are really dominating the landscape of community violence. Compared to when we started this work in the 90s, it was lower calibers, as I said, 25 calibers. And that has implications for death rates. The implications that perhaps this is adversely affecting the outcomes. So great question. So thank you so much.
Thank you very much. Question from Kyle.
Thank you so much, Stephen. This is super interesting. I really appreciate listening to you every chance I get. Question about how you feel this kind of linking in with policy and advocacy. On the one hand, people have struggled to create like the perfect definition of like an assault rifle, and I could see how, kinetic energy might be part of that. On the other hand, I can see, a hunter saying, well, higher kinetic energy means that I kill the deer on the first shot and I don't have to track it and shoot it a second time, and it's more humane and it's better, which is a valid argument. Just curious how you're thinking about how you would use these numbers.
Thank you so much. It's great to see you, Kyle. And it is an area that we wish to explore. If you think about all the AR Style 15 rifle platforms that are being manufactured, and there are a variety of platforms, and that they look different, they have different opportunities for putting on whatever the person wants to have for the AR Style 15 platform. The fact is that they fire the same bullet, 5.56 NATO or 223. And so classifying the firearm by what it does and the capacity for what it can do, in this case, an AR Style 15 rifle with let's say, a 10 or 30 capacity magazine can release energy in 10 seconds. That's very different than the release of energy from a hunting rifle, which can release a large amount of energy for sure, as you mentioned, Kyle, but it has a different capacity to harm, and it's intended to do that. So I think that leads to some discussions about how to classify these products. They are products manufactured, and how we can classify them in a different way. From the policy standpoint, which I think is, again, something to think about, California just passed a law for taxing ammunition, and they tax the ammunition across the board the same way. For our studies, I would suggest perhaps taxing them in a different way, according to their kinetic energy release. So a 22 caliber Plinker bullet that we used in Boy Scouts is different than an AR Style 15 rifle 5.56 NATO. They should be taxed differently because of the implications for harm. And so I think that's something for, again, for our policy discussions, because we have the data now to show that this is different. These have different implications, and these firearms that carry these bullets have a different capacity for harm. And I think that's a way in which we can inform policy discussions in a more rigorous science-driven way.
Thank you. That's really helpful. Yeah, the tax thing, that makes total sense. And I guess I hadn't really thought of, perhaps the measure isn't kinetic energy per shot, but, the kinetic energy per minute fired of what is possible. And then you could standardize for a bolt action 223, which would be very different from you know, something different.
So thank you. I think it's something that we want to continue to look at. And we're also, with our expanding studies into our colleagues in England, we were able to fire firearms from across centuries of technology. So we fired a musket rifle. And so we measured the energy of the musket ball. And we know that the rate of fire of a musket rifle is 2 to 3 musket balls per minute, compared to what an AR Style 15 rifle can do, greater amount of energy, greater wounding potential, and they can fire many more bullets per minute than a musket rifle. So we've done musket rifle to a Winchester 1873, a Springfield rifle of 1903, all the way to modern firearms. So we wanted to look at that across a spectrum of firearms, across a spectrum of centuries, and we did the same thing with handguns.
Thank you.
Thank you. Other questions? I don't see any other hands or questions in the chat. I do have a question for you, Steve, if no one else has any. Um, so the previous question asked about the role of firearm users and conversations that you might have with different groups of firearm users. Have you taken this work to manufacturers and legislators, and can you talk about how those conversations look and the role of prevention in shaping those discussions?
Thank you, Chris. And I would welcome the opportunity to speak to whatever group invites me to speak. I am happy to. Our researchers are also open to these kinds of conversations. The manufacturers have been, and they continue to rely on their products' performance, the performance of how that bullet leaves the firearm in a predictable way towards a target. And that performance is really driven the standards of firearm production. And that started to happen in the 1900s, where those standards were uneven with firearm manufacturers. But we don't see any element of safety. We don't see any element of other elements of the firearm manufacturing community looking at other elements of what their products do or the implications of what their products do. So it's a really great question to have. So I think it's something that I'd welcome the opportunity. We've had in my past work with establishing a firearms center. We welcome opportunities for the Shooting Sports Foundation and other groups to come and discuss about firearms and their implications. In terms of policymakers, again, I would welcome the opportunity to speak to staffers, and I'll give you a side story that didn't go very well, but I'll tell it anyways. So when Senator King was commenting after the Lewiston mass shooting event, he stated that he didn't care what AR style 15 rifles look like. He cares what they do. And so I sent an email to his staff website saying, Dr. King, I fully support your position about this, and I would like to show you what an AR style 15 rifle does. And like this presentation, I showed you what AR style 15 rifles can do with a 5.56 NATO. So I said that to his staffer. I want to show you what an AR style 15 rifle does. The next day, the staffer said, I'm not a constituent of Senator King. You need to work with your senators in Wisconsin. 4 days later, I was in the same room I am now with this discussion, and my wife calls me down and says, the Shoreward police are here. And they asked if I was on social media. I said no. I was wondering if maybe I had a traffic ticket that I didn't that I had or something. I thought I was fine. I want to show you what an AR style 15 rifle does. They took it as a threat. I was so dismayed by my naivety of saying this to the senator's staff. And it really was an unfortunate incident for me that I wasn't framing what I wanted to show and demonstrate like I've done today. So to your question, Chris, I'd love to make amends to Senator King's office. I would love to have the opportunity to talk to staffers because I think this is a different way, a complementary way to understanding gun violence that has had limited exposure. And with our technology now, we're able to present this in a more science-driven way, as I've attempted to do today.
Thank you. And yes, orienting to the science is certainly central to these discussions. Jennifer, with the hand raised.
Hi, Steve. Thanks so much for this. Was really, really informative. And I my question is similar to Kyle's in that I appreciate this quite a bit when it comes to ballistics. And I think you're tapping into something that exists more broadly from a policy perspective. We tend to legislate around hardware or particular brands or particular pieces of equipment and not around the impact those things have on a body. And so I'm wondering, your Senator King story was insightful, and I thank you for sharing that, even though it didn't have your desired outcome. But is this a conversation that we have about ballistics, or is there a way to make this part of a broader conversation of, for shifting the orientation for policymakers and legislators from what things are to what things do? Does that make sense? Have you had any other experiences?
That's great. Thank you so much, Jennifer. It is, I think, at a moment of a paradigm shift for this discussion that I think we're on too. And again, having an opportunity to speak to um, um, policymakers would be a welcome opportunity for me. Think about the AR Style 15 rifle ban in 1994, where they were talking about this firearm. But there's so many different ways to look at this firearm, but what it looks like. And one of my early mentors in this field was a guy named Monty Lutz from the Crime Lab. And he said, well, they're all talking about is an ugly gun. And for policy to be driven by such amorphous categorizations that occurred, we can shift that policy discussions by what these firearms do, their capacity for harm. And in this case, the capacity for harm differs widely among these products. So having that discussion is, I think, an important opportunity to think about access to this. Is an 18-year-old, is a 21-year-old, is that an appropriate access? And so it perhaps has a discussion for regulation of these products by their capacity to harm versus some other policy discussion that doesn't hit to this newly informed science of wound ballistics that complements what we want to have with youth that and criminal background checks and access to lethal means for depressed individuals and removing the gun and all those other approaches. I think that we have an opportunity to complement the discussion by demonstrating and being able to demonstrate by what bullets do to human tissue and having a discussion that perhaps informs the policymakers to say, okay, well, where do we draw the line of lethality or the capacity for lethality for regulation of this product? And I think we're seeing this in other countries where they have a different policy discussion compared to ours, where there's a Second Amendment backdrop of all the discussions. My feeling is this has everything to do with what the product does, the firearm itself, rather than the right to have access to that product. And I think, again, I'm not a policy expert, but I think it has an opportunity to inform policymakers in a different complementary way, as you're suggesting, Jennifer. And I think that we'd welcome that opportunity to be able to demonstrate that visually as the video camera does now, where you see the difference between a 25 caliber and a 223 caliber, pretty much the same caliber, and wildly different outcomes. We're wanting to measure that temporary cavity formation along with the kinetic energy deposit to further classify these bullets in a way that's never been done because we now have that technology to be able to specifically measure the temporary cavity, which has significant implications for injury.
Thank you.
Thank you. I don't see any more hands or questions, so I'll ask another question it comes to mind for me, which is that we've talked a lot about policy implications for policy for manufacturers, legislators, people who use firearms. What are the implications for research when we're conducting research of firearm injury and firearm mortality? We often dichotomize injured versus non-injured, fatal versus non-fatal. This is making me think about other ways of involving information about the firearms themselves. How do you incorporate this information into, say, epidemiologic studies or other studies of injury outcomes into your own work, and what suggestions do you have for us as a field?
Great. Well, thanks so much for the question, Chris. And as I was mentioning earlier in response to Kyle, we feel that this is on the pathway to further inform the clinical outcomes of our patients who are struck by these bullets. And by linking the bullet with the injury more explicitly. And it has not been done in an explicit science-driven way to date. It's been driven by, well, it was a handgun, it was a rifle, it was a low velocity projectile, high velocity. And we feel that that's a start, but we think that this quantification is much more specific and characterizing these events, non-fatal or fatals, as to what these bullets do. And it has implications for clinical care. And I think it's important for us to recognize that as we seek to further strengthen our approaches to taking care of patients, as well as informing policymakers that these bullets have a higher lethality potential, and we want to characterize this along that line and perhaps in a policy discussion draw a line with that. But it has implications, as I said from the start, for clinical care. We feel, and I feel, that non-operative care of a patient who's injured by a bullet has significant downstream implications for that decision making by the surgeon. And I think that pairing research that we think is helpful with our studies is an important advance. We want to take care of patients better by understanding the dynamics of what bullets do to human tissue, to bone. And I have an X-ray that I've shown in previous presentations of a bullet striking the femur. The bullet shattered. The X-ray of the femur looks normal. And yet the bullet's shattering suggests all that kinetic energy of that bullet was impacting the femur. But we didn't think about an occult fracture. And in fact, there was an occult fracture, which we missed. So understanding the dynamics of what's happening with wound ballistic studies that we can now show helps us understand the dynamics for care. We've also done a study where we took a femur of a pig, embedded it into the gelatin, and we then discharged a 5.56 NATO, not directly on the femur, but adjacent to the femur, 8 centimeters away, where the maximum temporary cavity formation occurs, like I demonstrated on our video today. And we wanted to see if there was going to be a fracture, when in fact there was. And so clinicians may think, well, the bullet's not that close to a vital organ. We think that there are implications for these injuries that are more downstream than we've ever thought about in terms of nerve injury, neuropathies, pain control for these patients where they are having nerve damage, which we didn't recognize because the kinetic energy stretched and damaged the nerves, and they're having these painful clinical outcomes that we've not fully understood. So again, to your point about research implications, of better understanding what happens to these patients, and especially what happens to them downstream, is an important area that we want to further explore for strengthening our care of patients.
That's terrific. So we've got some quite concrete research implications and also implications for policy discussions with manufacturers, firearm users, and so on. I don't see any more questions in the chat or raised hands, so we can bring our session to a close. Please join me in thanking Dr. Steve Hargarten for a terrific talk. Thank you.
Very much for the opportunity.
So our next seminar is on March 11th, and will feature Michael Ulrich, an associate professor of health law, policy and management at Boston University School of Public Health. If you have any questions, please feel free to reach out to the team here. But thank you very much, and thank you for joining us.
Thank you.
Thanks, everyone.